Thank you for having me today. For those that don't know, Vitality, I'm assuming most people in the room know, is third or fourth largest health insurer in the UK, depending on the stats that you look at. And as I was introduced, I head up health strategy. I've got an interesting topic of conversation. I don't know if anyone else here has been listening to the news and hearing some of the kind of reporting that's been going around about all of these services that health insurers are offering. Are they just increasing the cost of PMI? And is it going to become unsustainable, right? So I think this is a kind of measure that's going around. And when people are talking about that, they're talking about a lot of the stuff that goes on in prevention, a lot of the stuff that's being added onto services in primary care. And I think it's a really big question, that of how big does this get? How expensive is it going to make it? And is this a problem? So what I want to talk about is actually to say there is a really significant reason why insurers like us invest in prevention, why we invest in primary care and why we offer these services. But really to say that it's not just a box-ticking exercise. There are real reasons under this that we think are kind of significant in terms of the health dynamics, some of which we just heard about, actually. Mental health I'm going to talk about a lot, because that's one of the really key ones around addressing issues early and getting people to help as quickly as they possibly can. So I'm going to go through a few kind of key pieces on this and then answer any questions. Good, the clicker works. So I think, you know, everyone in this room knows this data, right? We have seen unprecedented growth. I mean, I've been in this industry for I'm not quite sure how long, since I left medicine. And, you know, we've seen growth that I've never seen before in terms of kind of people wanting PMI services. But the utilization of those services is really, really under strain, right? So we see, you know, the NHS, and this is just one part of it, right? We've also got issues around the changing condition, changing profiles. But one of the big pieces is around NHS waiting lists and how utilisation of PMI is directly correlated to NHS waiting lists. So what does this mean in terms of, we've got this brilliant growth of PMI and people obviously want these services, but we've got a real challenge with thinking through what does this mean for utilisation? And this is why my sincere belief is we've really got to rethink the model of care. And this is why I'm going to talk about prevention and primary care. This is just a bit more data on why the NHS waiting list is so directly correlated, right? If it's, you know, we've done some research to say what is the top reason you take out health insurance? And it's number one reason is around concern about NHS waiting lists. And then in the last 12 months, if you look at this, you've got nearly 3/4 of people actually using their private health cover. This hasn't been something that we've historically seen. And there's a reason for that in the terms of the dynamics of it, because actually you can see in the bottom there, a lot of it is more on the primary care side, right? It's not just that people are now going to hospital more, it's the types of claims that people are coming for. But it's a very, very different dynamic. You know, health insurance is not something, and we certainly don't believe it's something that sits in the bottom cupboard and, you know, you hope you're never going to look at it, right? This is something that people are now engaging with on an ongoing basis, and that's great, but we need to think about that model of care. And you can see, actually, we talked a little bit earlier, we heard in the talk earlier a little bit about some of the changing dynamics with age as well. So the need for prevention has never been clearer, right? If you think about kind of increasing utilisation of health services in general, right? Changing dynamics in the market in terms of the health profile of individuals and what that means for healthcare costs. So we're doing everything in our power to think about how can we get people healthier, right? Vitality works 100% under a shared value model. What is good for us is good for our members, is good for society as a whole, right? If we can get people healthier, we can enhance everybody's experience. So that's why we invest so significantly in this area. So, you know, we've shown that really actually if you invest in an incentive-based behaviour change programme, you can see this amazing data, right? We can increase people's physical activity. We can reduce the amount of fatty foods people are eating. We've seen some fantastic results on quitting smoking, weight loss, and even diabetes reversal. And this is all about what we have around a 3-step model, right? Which is help people understand their health, number one. Make it easier for them to get healthier, number 2, and incentivize them for doing that. And that's the shared value, right? Which is to say, if you are going to do these things, we see a massive benefit as an insurer, right? We absolutely know that the risk of hospitalisation is correlated with how active you are, how engaged you are in your preventative activity. So we want to share back that value with our members in this shared value model. So the need for it has never been clearer. We've shown a little bit, again, I showed you on the previous slide the link with physical activity. This is around claims costs based on our statuses. So with the Vitality programme, the more kind of preventative activity you do, the more points you get, and you accrue a status from bronze up to platinum, which is our highest status. And with that comes kind of big annual rewards that you can get. And you can see that it's directly correlated in terms of our claims. And then this is around physical activity and specifically some of the kind of mortality and life expectancy pieces. But it's not just about our claims, right? For everybody in this room, your big concern is around employees. So when I talk about that shared value model, we've shown that it's good for our members, right? It's good for our members to be physically active and healthy and eat well and quit smoking and lose some weight. That's really good. Well, I've shown you it's great for us as an employer for that. And then really looking now at us as an insurer for that, looking now at the employer stats on this, this is some of our data from the latest Britain's Healthiest Workplace that we did. The amount of productive time lost per year is increasing and is shocking. This is per employee, and you're getting over a month of time being lost each year. And it's just, there's a bit of a jump you can see, but that's mainly because we didn't run the survey during the pandemic. So you've got 2019 to 2022, but you can see that this is increasing. And we're not seeing any improvements here. The vast majority of that is coming from presenteeism as opposed to absenteeism. But the stats around what this lost productivity means are huge. Healthier employees are more productive, right? So we have a metric within Vitality, which is called the Vitality Age Gap. So that's really just the difference between your chronological age and what we would call your health age. How healthy is your body? So negative is good. You are healthier than your chronological age. Positive is bad, i.e. if you are 50 and you have a vitality age of 57, your vitality age gap is 7 years. This is not good. And you can see that essentially productivity is linked to the vitality age gap. And that's just purely based on your health status. And you can see that, again, it's linked to very key things, right? So looking at productive days lost each year, at risk is the grey bars, not at risk is the pink bars. And you can see at risk have significantly more productive days. So if they're at risk of depression, burnout, physical activity or diet, if you are at risk, you are significantly more likely to lose productive days. So this is a really big issue. I thought my clicker had stopped for a second. There are a range of issues underneath this, right? So, you look at the headline numbers and we talk about at risk, but this could come from physical inactivity, unhealthy diets, obesity, anxiety, depression. So, it can be a range of things, and it's usually a combination of things. When we look at cutting the data by different metrics, you look at mental health really is a key issue for the younger age groups. And I agree in the last talk, is it that it's getting worse? Is it that it's more talked about, more acceptable to talk about? I do think there is probably a combination of those things. But as you would expect, the older employees are more focused on some of the more physical elements of their health. Younger, it's more the mental elements of their health. But needless to say, I would argue that most people in this room probably have a combination of older and younger people within their workplace. So really have to think across the board about this. But younger employees are actually losing more productive days. And again, a lot of that is coming from presenteeism as opposed to absenteeism. This is a really interesting one, considering the last talk that we just had, which is it's not an issue often with how many benefits people have. So, we actually found that there were a number of interventions that employers are offering, that if you then look at the bottom, that employees who use them actually find them really useful. The challenge is in the middle there, which is, are people aware of them and do they use them? Right? That's where the rubber hits the road. And it is around engagement and early engagement, and not, a bit again to the earlier talk, not about crisis management at the end, but how do you get employees to engage early, intervene soon, and actually utilise the many interventions that are often in place. some of it is around lacking the motivation to change, and then some of the issue is around, the challenges we have. I mean, we talk a lot about behavioural economics and why people don't do often the right thing for their health and well-being. And a lot of that can be around present bias, right? We're all focusing more on the day than the future. Optimism bias, we often think we're a bit healthier than we probably really are. Nudges and incentives, really important in this. If we build it, they will come, is not the way to manage employee health and well-being. Loss aversion, that's a big thing for us. And I don't know if many of you have heard about our Apple Watch benefit, but essentially we give people Apple Watches and they, by doing physical activity, kind of earn their Apple Watches. There's a huge piece around loss aversion there. And then hyperbolic discounting, which is around overvaluing the present to the future. And then this is our show-off bit, our show-off slide, which says basically, for Britain's Healthiest Workplace, we compared organisations with and without the Vitality programme, and actually looking at people's sort of mental and physical health and the improvements that those with access to the Vitality programme and the scheme that we have in place around the incentive-based behaviour change, some of the benefits that accrue. So these final ones are really then around, having better Vitality age gaps, and as we saw earlier, that is then linked to improved productivity. But it's not just about the bottom. So I've talked a little bit about the bottom of the pyramid here, right? All the bits around prevention. And then most of you probably would think, I spend most of my time in the top of the pyramid, right? Working out about hospital treatments and what PMI covers and what it doesn't. But actually, a huge chunk of what we do is in this middle piece, which is the everyday care services that we offer. And this is where we've seen the seismic shift. So when it's GP appointments, physiotherapy, talking therapies, we have seen a massive change in the way in which people want to engage with their health insurance. Clicker, not behaving as well as it could. And why is that, right? When we see the opinion on this, what aspects of health insurance are most important now and in the future? And in a funny way, they're kind of very matched. So the now and in the future is not that interesting. But looking at the order of things is really interesting, right? Number one is better access to private GPs. I mean, I have to say, 10 years ago, I would not be standing on a stage saying that, right? It would all be about hospital care. This is fundamentally different to how people want to engage. And again, kind of back to what I said right at the beginning, part of that is around access within, the public environment. Part of that is around changing the way in which, in which diseases are manifesting and conditions are manifesting, and part of that is around behaviour change and how people are engaging. We're meeting that demand, right? If you look at the offering that we have within our world, we are seeing exponential increases in the amount. So if you look at the far graph, pink is our GP appointments, you've got talking therapies, then you've got physio in the sort of turquoise, and then you've got optical and dental in the purple coming in. We've seen a huge increase in the amount that people have engaged. Our GP consultations alone is an enormous increase. And that is because we are meeting the demand. And as a result, what you're seeing is, of course, exponential increase, and we saw that in terms of the claims, right? Which is to say, by number, there is a massive increase in the amount of people that are engaging on an annual basis with their PMI. But this kind of comes back to then the piece that I was saying right at the beginning, which is everyone says, oh goodness, does that mean that we're just adding massive amounts of cost into PMI because suddenly you've got all these GP appointments that everyone wants? And actually, if you look at these graphs, what you actually see is, yes, we've seen a massive increase in primary care services, but actually that's been matched very successfully with a commensurate decrease in some of the secondary care services. So this is all about, can we get the right people to the right care at the right time in the right environment, as opposed to everyone ending up in a secondary care environment, which is what you see often within kind of PMI world. So we're really invested in kind of moving down that pyramid to say, if you don't need to be at the top of the pyramid, we don't want you to be at the top of the pyramid. Can we actually get it earlier and intervene earlier? And we've shown huge success. The interesting one here is that last little comment, which is to say, actually, we found that engagement in talking therapies not only reduces the claims, psychiatric claims, it actually reduces overall claims. So that's just a little nugget there on the link between mental and physical health that's quite interesting. You'll be pleased, I am very nearly coming to the end on this one, but one of the key things here is around, and this goes to this piece, which is if you build it, they will come, is not quite the right attitude to have. You need to have these sort of seamless journeys that people can engage in a kind of simple and intuitive way to be able to get them to the right services at the right time. And that's one of the key pieces, as opposed to kind of in the previous talk where you saw this kind of array of different aspects that you could offer. How do you make that simple, intuitive and appropriate for a member? And that's where we've really invested in these digital journeys to get people to the right place. So, we're seeing a lot more of our claims now starting online. We're getting, whether that is for primary or secondary care services, there is a digital route into those. And as a result, actually guidance through those journeys in a way that traditionally insurance companies have never been able to do, which is to say, I can get you to the right care, right time, right place through this digital journey. And a little mention on the end, one of these is around Premier Consultants, which is we now look at all of our consultants in terms of their lengths of stay, the number of people who change their consultant as an indicator of people's satisfaction with their consultant, readmission rate and total generated spend, and actually then can guide members, if appropriate, towards what we would call our premier consultants through this digital journey. So even right at the top of the pyramid, this digital journey can also help lead people through to the right consultant at the right time that covers the right things for the condition that they are seeking treatment for. So I've got 5 key recommendations. A lot of people have slightly less than that. Number 1 is prioritise prevention. This is genuinely fundamentally important. Those graphs I showed you at the beginning in terms of utilisation, this is whether it's the public sector, private sector, within organisations, for individuals themselves. Prevention is key, otherwise it's only going one way in terms of people's healthcare costs. Focus on a personalised, data-driven approach. Right? We all get told to quit smoking, eat healthily, do some physical activity. We even really invested in something called next best action, which is to say, what is the single next best thing for you as an individual with everything we know about you that you can do tomorrow to improve your health? So think about how we can use data for personalised approach. Provide employees with everyday care benefits. We've already seen the benefit down the line of getting people to the right care at the right time. So get those and get people to engage in those to reduce those more severe claims. Again, engagement is key. If you build it, people don't necessarily just come. And then make sure that you sort of set up those patient-centric journeys, right? Don't end up, like we saw in the slide of the last presentation, with an array of things that no one knows what to pick from the sort of, cherry basket of options that they may or may not want or need. That is the end of my talk. I think I can have some questions, probably.
Thank you so much. Yes, we have some on Slido. So, Katie, the first one, slight curveball in some ways. Where do you find your private GPs?
So we have, we have 2 private GPs. So we've got a virtual network of private GPs for virtual online appointments, which actually is the majority of our GP appointments. And we've got face-to-face. For our virtual, our partner is Livy. So they actually are our kind of key virtual GP partner. And then we have a few different providers for face-to-face GP provision, depending on where people have clinics.
Okay, the next question. What kinds of workplace incentives work best in your experience?
Big question. So there are a few things in there. One is around what is the right cadence with which you give incentives. And this is something that we think about a lot. Is it daily? Is it weekly? Is it monthly? Is it annual? And actually, we therefore offer quite an array because people do different things for different reasons depending on that cadence. So things like our physical activity, we've got active rewards, whereby your weekly physical activity is linked to weekly rewards. It's very instant, very tangible. We've also got monthly rewards to say, actually, if you keep going for a month doing this, you'll get another kind of battery of rewards. And then we have the big annual ones if you can kind of keep going for that long. You don't want to end up setting everything as big and meaty at a year because it's just a really long way and a lot of people won't get there. But also at the same time, obviously it tends to be, if you're doing weekly rewards, slightly smaller rewards. So you need to then kind of think through that array of rewards that you can do. Piece of research that we just did actually, that is quite interesting, is that on average it takes between about 6 and 8 weeks to form a habit. And that's really where you want to get everyone to. That's where the rewards really, really help, is getting people to build up to that habit. So, that's more the cadence. The specificity in terms of which work best, again, it is slightly horses for courses in often cases. So one reward's not going to work. So you might want to just pick a few to think through for your population which sorts of rewards will work.
This is really interesting. The importance of the how, not just the what, really comes through in that. Next one, how do we encourage our future workforce, our teenagers, to adopt healthy behaviours?
Really big question. And, we grapple with it. We grapple with it, I think, because of the environment. So, it can be a school environment, it can be a home environment. Where is the right place? In my view, if you do it only in one environment, it doesn't necessarily bleed into the other environment when you think about where children are. So there needs to be quite a kind of consistent messaging. But I think there is, that I would say bakes in a whole load of different things, right? One is kind of around access and provision at a kind of government level. 2 is around that sort of behaviour change element. And then 3, I think, is around education for the future.
Thank you. And finally, do you offer a service where colleagues can pay through their wages without an employer contribution, so a flex scheme or a self-paid mechanism where the employer isn't the one who's funding the benefits?
We have individual and family policies that people can access.
Yeah,
absolutely.
Yeah.
So if you for our overall provision, a large chunk of it comes from anything from very small businesses through to very large businesses. But there's still about a quarter of our business that is individuals and families.
Yeah, and I'm assuming within an employed workforce, some people might have a company benefit, others might have an amount of money they can spend on flex. So, you can reconfigure according to that employer's budget.
Yeah. And for any details, the lady before me actually knew her stand number, and I was incredibly impressed. I do not know our stand number, but I know there is a Vitality stand out there. Sort of come out of here, turn right, and you will see some pink. We're always in pink. And, we've got obviously plenty of people there that can talk through any of those, particularly those sort of technical questions of the different sorts of policies that you can set up.
Fantastic. Thanks so much, Katie, for your time. Thank you.